Hey guys, my name is Chris Chan. I'm the owner of Chelsea Place Senior Care and the host of Senior Source TV. Thank you so much for joining me today. I got a quick tip for you. 6 differences between Medicare home health and private home care. Trust me, this is confusing even for those of us in the industry, but let me break it down for you, okay? So Medicare home health, the reason why you would need those services is you might need physical therapy, occupational therapy, speech therapy, nursing services such as wound care. Whereas in private home care, you're using those services because you might just be exhausted. You might be caring for your mom, your dad, your spouse, and you're just worn out and you need a break. And we might come in there and provide some relief for you, make sure mom or dad is safe, and you can go out and have lunch or run errands or just get a break. Just go relax. So we're going to be able to help you out with homemakers, companions, transportation to doctor's appointments, medication reminders, toileting, transferring, any of the activities of daily living, meal planning, shopping, all that kind of stuff. So typically that'll be what someone would need private home care for. The other thing is when it comes to how do you pay for this stuff, right? Medicare home health is going to be covered by Medicare or Medicare Advantage health insurance plans, typically for a therapy service. In private home care, it's going to be primarily private pay. Long-term care insurance, you might have a policy and it might pay for private home care. The other thing is there's some VA benefits and also some statewide Medicaid Managed Care programs, some financial assistance that's available. However, most people you'll find is it's paid out of pocket. It's a private pay thing. The other thing is in Medicare home health, the third thing would be is that it's short term. You may have gone to rehab or the hospital had knee surgery or hip surgery, and now you're getting out and you're going home. And this would be a nice bridge from rehab to home to get you back to being independent. So we might send someone out to the house and do physical and occupational therapy with them to help bridge that gap, right? In private home care, it's going to be more long-term. You called private home care because you're just exhausted. You just need a break, and you would be helpful to have this on an ongoing basis. So you might start out just 1 day a week. Hey, I'm gonna just 1 day a week, I'm gonna just take a breather, right? And you might up it to 2 or 3 or 5 or however many that it's useful for you, but it's ongoing. It's more of a long-term solution for you. Medicare home health is going to be staffed with registered nurses, LPNs, physical therapists, physical therapist assistants, occupational therapists, OTAs, the assistants as well, speech therapy. So it's going to be more of your therapies and your skilled disciplines. Where for private home care, you're going to find caregivers, home health aides, certified nursing assistants, CNAs. So you'll have more people in that field that are good at personal care. Medicare home health, you're going to find is average visits are typically going to be between 45 minutes and an hour 3 times per week. It's going to depend on what the need is for, what type of therapy is it for. It's also going to depend on the insurance that you have and what they approve or they allow. Also depend on how you progress through that process and how fast do you get better versus, they might have to add on more time. It all depends though. It's all worked out through the insurance company, but typically we see 45 minutes to an hour 3 times a week. Private home care, you're going to see average visits. I know a lot of places might have a 4-hour minimum, some may not, but you'll see average visits somewhere between 4 hours and 24/7. It's all, again, depends on what you want. So Medicare home health, the 6th thing is that a doctor is going to have to write a prescription, write an order. That doctor is going to have to send that prescription to the Medicare home health company, and then they would schedule services and get things set up. So you would have to actually schedule a doctor's appointment to have that done, or a physician order would have to be sent out for that. Private home care, maybe a family crisis. You just call us up and we'll set it up for you. We'll send someone out to your house and we'll do a little consultation and figure out what it is that you want and develop a plan based on what you want, but you don't need a doctor's order for it. So hey, this is my quick tip for the day, 6 differences between Medicare home health and private home care. I hope this was helpful. If it was, please do me a favor, share, comment, like, make sure you share this with people that are going through the same thing that could benefit from this, because it's helpful to be informed when going through this process. It's a difficult time, and we want to make sure that we add value every single day to all of not only the people that we care for on a daily basis, but those that are doing it on their own and that could just use a little bit of help. So If this was valuable, please comment, share, or like our page. I really appreciate your support. I know this wouldn't all be possible if we didn't have an audience like you. If you have questions or if there's anything else that you'd like us to cover, please let us know. We're happy to do it. If we don't have the answer, we'll find out for you and we'll make sure we get it to you, because all these questions are going to be so helpful to other people that are searching for these answers. So hey, thank you so much again. I hope you have a fantastic day. Oh, by the way, we have created Florida's 5-Step Guide to Senior Care. It's a great resource. It's completely free. I'd love to send it to you. If you look on the link below in the About section here, we will make sure that we send you one. Just fill out the form there, and we'll get you a PDF copy if you'd like. We can also mail you one too. So thank you so much. Get our guide. Thank you for following. We appreciate all that you do, and we'll talk to you soon. See ya.